Hello everyone, today's topic is all about bunions. What are bunions? How can we prevent them? How can we treat them? And we're really thrilled to have, once again, from Hurst Podiatry, we've got Brenton here to help us navigate our way through this topic of bunions. Hello, Brenton.
Hi, Wendy. How are you?
Very well, thank you. I'm bunionless, which is good. So if we can kick off maybe, and maybe you can tell everyone, just to start with, what are bunions and what causes bunions to form?
So bunions, so there's actually two types of bunions. There's the one that most people will know, and there's the forgotten about one. So I'll explain the more common one. So it's when the big toe basically starts to migrate towards and point in orientation towards the middle of the foot. And what will tend to happen as part of that migration is the first metatarsal phalangeal joint, which is the big toe joint where the foot flexes there. That'll kind of stick out to the side of the foot and you'll get these bony lumps start to form. So that's the most common type of bunion. That's the one we probably see 9.5 times out of 10. But it can get a tailor's bunion, which is actually the little toe joint, can do much the same thing. It can migrate and point towards the middle of the foot and stick out and cause a similar thing. Less common. Interestingly, tailor's bunion, it comes from tailors used to sit on the floor, and the theory used to be that they got them through the pressure of being in that sort of cross-legged position all the time. But that's sort of a bit of a myth. But yeah, interesting little historical note. In terms of the actual bunion, the truth is we don't totally know what causes them. And it's like most of these types of pathologies where probably the answer is different depending on the person. So what we do know is there are certain things that we see commonly linked to bunions and there tends to be a bit of a commonality. So the most common causes, you will typically see them in older folks. Can see them in kids, but they're nowhere near as common. We do think narrow, pointy shoes can contribute. It's probably no coincidence that the foot ends up looking the shape of that shoe later on. So we do think that's a factor. But we also know that certain foot types and certain foot mechanics, so the way a foot is shaped and the way that someone walks, those things typically go hand in hand. We know there's particular foot types that tend to create bunions. So we see them more commonly in flat feet that roll in, because as we roll in, we're putting the weight on the inside of the toe, and that can contribute to pushing it off. With this also, I won't get too technical because it probably won't interest your listeners too much, but the length of some of those metatarsal bones, the position of the heel, there's lots of little subtle things that we are still researching, but we think contribute to the formation of bunions. So quite multifactorial, quite a number of combinations that can bring together a bunion. And then also just what we do over a lifetime. You're going to see them more commonly in people that take up ballet dancing than people whose primary sport is walking the dog around the oval sort of thing. So yeah, a whole lot of factors can come together to bring it. And the more of those risk factors you bring together, the more likely you are to end up with a bunion.
Fantastic. Well, I heard your comment about the pointy shoes, and I think it's just another excuse for us all to wear comfortable sneakers. But how does it impact older Australians? And is this a really common thing that older Australians are having to deal with?
Yeah, it is. It is something. I don't know there probably is some good studies around that tell you what percentage of populations in specific age brackets. I don't have those numbers offhand, but it is something anecdotally we see all the time in the clinic. And I would say it's one of those things that both the frequency and the severity of bunions sort of correlates with age. The older you're getting, the more likely you are to see these things pop up. The irony with bunions is, in a lot of cases, the bunion doesn't actually hurt. So they often hurt quite a bit while they're forming, and that foot is remodeling and changing shapes. We've got ligaments getting stretched and bones sort of becoming arthritic in that process. And that can be quite painful at the time. But very often, by the time we're getting into the age bracket of most of the listers, that 60 plus type realm, often the bunion itself is largely formed. It's the size and deformity that you're going to see long term. And what they're actually dealing with more than pain in the bunion itself is secondary problems. So it's trying to fit this very broad foot into a shoe. It's the fact that you often see claw toes go alongside bunions and they end up with corns and things that are annoying them. It's the fact that the toe might be crashing into the second toe next to it and rubbing. It's all these secondary concerns, not the actual bunion itself. And that's probably where most of the guys will be getting impacted and having issues with that sort of thing. So often the approach I'm sure you'll ask me about treatment of it later on, but often the approach is how can we address those little secondary concerns rather than dive headfirst into a really large surgery or something to correct the actual bunion itself.
Yeah, and I actually hadn't thought about all of those secondary things, like the rubbing and the corns and all of those, and blisters, and I guess that's what also contributes to it being a painful thing. But did I pick up on you saying just before that it's not particularly painful? I guess once the toe has moved and you've got bunions, that it's not painful?
It's not universally true, but it's pretty common that that's the case. People often, I have so many sweet little 80-year-old women sit in my chair and say, I've got this thumping big bunion, but it doesn't give me a lot of trouble. But I do have this horrible corn on my little toe that gives me all sorts of grief. And they haven't actually joined the dots at the width of that foot, because when you're trying to put a really big bunion into a normal shoe, I always say it's a square plug in a round hole sort of quandary where this foot is no longer the same shape as the shoe. So the bunion itself might not be popping the brunt of that, but yeah, you could have a little toe that's getting smushed up, and it's a lot of these secondary problems that become the primary concern, and the art form often is just trying to work out ways of managing and dealing with those more so than actually the bunion, even though it is the cause. But sometimes fixing that is so involved that just addressing a bit more of a band-aid approach can sometimes be more practical for someone who's a little older.
So you've touched on it a couple of times a little bit around treatment. So how do you, if I walked in and I had, as you said before, a whopping big a bunion, how would you treat it?
So you've really got to, the conversation initially is around, do you want to get it fixed? And if you do, it's a surgical consultation. So most podiatrists, that's not in our scope of practice. We're not going to pull the general anesthetic out and start cutting you open. So we'd move on and give you some guidance on where to find a good surgeon. And the thing with foot surgery, and I don't want to get say anything I shouldn't and throw anyone under the bus, but sometimes you'll find surgeons that don't do a lot of it and will dabble in it, especially in the public system where surgeons have to work through a number of things, and it's kind of just whoever comes across my desk. And yeah, again, I don't want to throw anyone under the bus, but the more you can find a surgeon that really is experienced with foot and ankle functionality and is a well-versed surgeon, that the more likely the outcome is to be a good one. Because the art form in a bunion surgery isn't just making the bump go away, so the foot looks pretty, immediately afterwards. It's correcting some of those things I talked about off the top that actually are causing the bunion in the first place, so you don't end up with it just coming back again post-operatively. So that's really important. And then, so if we didn't want to do that, if we decided we didn't want to do surgery, then it really is about how can we just make that foot functionally comfortable? So do we need to change our shoes? Do we need an orthotic? Do we need regular corn management? Do we need little interdigital wedges and separators and things like that, just to deal with those secondary problems that are popping up? And then there's a whole nother category of treatment, which is sort of more preventative. So, but yeah, if you're talking about someone who's already got the bunion, we make a call on surgery, non-surgery, and then, how can we best make that foot functionally comfortable if we're not going to actually correct the deformity?
Yeah. And look, I think it's good advice in general, isn't it? If you are going to have any sort of surgery, try and find someone who, is a specialist in that area, that's just what they do.
You don't want the guy that just had a break on a Thursday afternoon. He normally does shoulders and he just shoved you in and cut your foot open sort of thing. You really want someone, you don't go to a dentist to get your calf fixed. Go find someone who really is a specialist in that space.
Yeah, no, that sounds great. Now, you just started to touch on it just before, where you said that there's a whole other raft. If we're not going to go down that path, that there is a raft of preventative measures. So, what can we do to prevent bunions? And I guess, what are the first signs of it? Like, for someone who is perhaps in their 50s, has no sign, is it something that could happen? What can people do if they don't have any signs of it to prevent this happening for their feet?
Yeah, it's a really good question. So bunions present, like a lot of pathologies, on a bit of a spectrum of severity. So depending on where you sit in that spectrum and where you're at, and again, weighing in age and things like that, I guess that's the art form of for us, is to kind of work out, well, what's the best, where do you sit, and where, where do we think you're likely to end up, and what's the best option to make sure that we get the best outcome possible. It's always challenging because you can't sort of do a treatment with one person, take the same person and not treat them and know measurably how much better they are. But particularly with younger patients, I often like to do, so imaging like x-rays are really good because you can get a little snapshot in time and you can measure the angles and the position of the bone, and that can be a reference tool to go back to and monitor your progression of the disease and I guess the impact of your clinical therapies. So the therapy options would be, most of it is mechanically driven. So if we can identify those factors that I talked about earlier that we think are going to contribute to the formation of the bunion, we can sometimes adjust them. If they're exercise or activity specific, maybe that needs to be moderated. Perhaps it's footwear that needs to be changed. And orthotics can be quite good too in terms of manipulating the actual function of the foot to try and minimize how bad that deformity ends up over time. And then also there's some good research too that there's a certain subset of exercises that can be useful as well, which is definitely something you can sort of play along with at home. Getting some of the small muscles in the foot to be a bit active that helps stabilize the big toe joint, that can be quite useful too. It's a really, really easy, low risk, low cost sort of a therapy that people can do.
Oh, that sounds great. Sounds like, at least there are some things that can be done. So whenever we're having a conversation about a topic with the community on Starts at 60 and our platforms, inevitably we do get some people talking about recommendations of home remedies. So what are your thoughts around home remedies, and are there any home remedies that are known to alleviate symptoms for bunions?
So the internet's a big place these days, and you can find all sorts of recommendations. One danger as a podiatrist, any social media feeds of mine are just haunted by really sketchy looking eBay foot products and things like that. So there are things out there like night braces and stuff like that. Look, again, people will probably jump up and down at me for this, but most of it doesn't work particularly well. So there's a bit of buyer beware with all that sort of stuff. But you can definitely do some good exercises and things. But really, the best thing you can probably do is go and get checked to see whether you actually even got a bunion in the first place. I have people come in and there's similar pathologies that can present, and they're like, I've got a bunion. You're like, no, you don't. You've got hallux limitus, or you've got a dorsal osteophyte, or you've got, there's other things that might be. So first off, check that you're actually barking up the right tree. And then hopefully that health professional can actually kind of guide you on, whether or not you even need to do anything, and if so, what that should look like. I think there's such a danger just kind of making medical assumptions based on what you found on Google.
Google, it's a scary place out there, isn't it?
Yeah, you'll end up thinking you got foot cancer or something. Probably it's it's a bit of the Wild West medically. So best thing you can do, there's definitely some stuff you can do at home, but and I'm probably biased, but I would suggest getting in and getting that advice from someone that is qualified to give it, rather than just taking a flyer on something that you've spotted online. So
now and my thanks, this has been fantastic, lots of information. And my last question, you've pretty much sort of touched on it throughout, and there's things that I've learned around I guess being slightly would never have thought about, for example, going and having some x-rays to, I guess, almost have a base point or a baseline if you think something's happening to compare back to later and things like that. So I think there's been some awesome information already that you've shared. Is there anything else you want to mention around what you as a podiatrist would do to help people treat their feet, and in terms of if they're coming into you and saying, I think I have bunions, or I have bunions, can you help me?
I think we've covered a lot of it, but the big emphasis would be on getting in and asking the question. So the x-rays are really good because they give you like definitive proof of where you were at a moment. The thing with something like a bunion is you've got this joint that's sort of sticking out and can rub on a shoe, and that irritation can make that joint swell. So it can, like day to day, it can look worse. You can be looking and go, oh, it's like doubled overnight sort of thing. But those bones won't have actually changed positions in all likelihood. So having something that, really gives you a line in the sand for this sort of stuff, it's like, when you get blood tests and things done, you need to be a bit more methodical about it and actually, take some measures that can be accountable, because really challenging for us. If I have someone walk into my clinic and then come back 3 years later and say, do you think it's worse? My memory's okay, but it's not that good, and they're looking at it too often. They're sort of eyeballing it every day, trying to decide if it's better or worse. So the best thing is to get in and get assessed and then start to work through all those options. Your podiatrist and whoever else you deal with will be wonderful at explaining what your options are. It doesn't have to be surgery. It doesn't even have to be anything. They might just say to you, look, it's really not that bad. Let's just keep an eye on it, sort of thing. So get in, get checked, and just make sure that you haven't got something that's going to worry you in the future, because trying to pull these things back once they've progressed, so much harder than trying to get in front of them. So what's that old saying, a pound of prevention's worth a ton of cure, or something like that? I think this is a pathology where that's particularly true.
Fantastic. We do love an old saying as well. So thank you so much, Brenton.
Pleasure.
It's been really informative. As always, you give us great information, and we love having a chat to you about all things feet. So thank you so much for your time today.
Pleasure, Wendy. Thanks for having me.